On this episode of Med-Surg Moments,
I've done something that I usually don't do, and it's pertaining with my hair.
My husband went golfing with his buddies, and I went on the big shopping spree.
Last week I interviewed, and I just found out on Monday that I will be...
So I did a sleep study.
Personal and work are the same thing for me. It's like work, wife, work, life, work, everything.
Our topic today is the ups and downs of float nursing.
I remember the first time I ever floated to a unit and the sense of dread that I had.
I had a huge sense of anxiety, but I remember one nurse gave me some great piece of advice. She said...
And when I got floated to that ortho floor, I was like, oh my God, there's wedges. You're checking rectal tone? Really? Like, how am I supposed to... They can't expect you to know everything about their floor.
It's just like the travelers always get the worst assignments. Everyone knows.
Part of what I also love about being float pool is
How do you navigate that, knowing that you're seeing new faces every time?
My secret is that I don't have...
Marcella, do you ever feel any pushback from any of the nurses come in?
People look at me like I'm an alien sometimes.
In my experience, other things you can do is make sure not only...
Those were great suggestions, guys. I'm actually going to take these to all the units. I do recommend before you jump into a float pool position that you actually just... This is Marcella,
Eric?
Trish,
Kellye,
Sydney, and Haley. Welcome to Med-Surg Moments, the MSN podcast. This podcast is an engaging look at the lives of and surrounding medical surgical nurses. We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey. Our topic today is the ups and downs of float nursing. But before we get started, let's begin with some personal updates. Kellye, why don't you get us started?
Sure, Marcella. Thank you. So for me, I've done something that I usually don't do, and it's pertaining with my hair. I've done something called a medium chop. I wouldn't say the big chop because the big chop is the chopping all your hair off, but I've done a medium chop and I'm excited about it, starting the new year off with a new look, just to get a fresh start on the new year. And for professional updates for me, like I said, starting this hospital clinical instructor role, very excited about it. Orientation is going great. We're partnering with Georgia State University Perimeter Campus. So I'm just getting the ball rolling, getting ready for my students, preparing, understanding what it's like to be an adjunct instructor now. So I'm super excited on this role because I feel like it's more into my calling. So that's about it for me. What about you, Trish? What's going on with you?
Well, thanks for asking. I'm settling into the new director role during a very busy season at the hospital. We're still seeing a lot of flu, and it's been a really unusual winter season for us here in North Carolina. We've had about 15 inches of snow and ice, and it's just something we're not used to accommodating. So it's been a challenge with getting staff to the hospital, and it's been really beautiful though. So really loved seeing the snow. Last time, Mark, my husband, went golfing with his buddies, and I went on the big shopping spree. I racked up. I got some great purchases. I got some new perfume and several pairs of shoes, and I included in there some needed shoes for work so that it wouldn't feel so bad to him when I walked in with all those things, right? But it was great fun. My daughter and her husband met me at the mall, and we made a whole day of it. So it was really, really nice. Enjoyed it. Sydney, how about you?
Things have been good, Trish. I'm glad to hear your shopping trip went well. I get to also hop on the new job train for updates. Last week I interviewed, and I just found out on Monday that I will be the new department head at my clinic for what we call allied health services. So it's pharmacy, radiology, lab, orthopedics, and physical therapy. So that is effective at the end of the month. So I'm slowly kind of doing turnover with the department head now. They're working out who's going to take over my position at my oral surgery clinic. But it's really exciting. I know everyone's only interested in my sourdough, so I'm sorry to disappoint, but I haven't made any sourdough recently. The wedding, I'm trying to watch the carbs, but I'll get back to it, I promise. And I'll start some new inclusions. I'm still only on the cheddar jalapeno trend. That's what everyone requests, but I'll try some new things soon and I'll get you guys updated. Wedding wise, there's not too many updates. We're still trying to pick out suits for my fiance, what color he's going to wear, all that fun stuff, planning the bachelorette. So not too much progress on that, but we're getting there. It's coming up fast though. I can't believe it's February already and we have like 8 months. So it's going to pick up soon and I'll have some more exciting updates for that. But Haley, what's new with you?
My personal update is going to be a bit of a bummer. We had a routine ultrasound scheduled and found out that we lost one of the twins. My family's been very supportive. I'm very lucky that I have a lot of support. But on a positive note, we do have one healthy baby that is still alive and still kicking. And my husband and I are really trying to focus on the positives of the situation that we have one healthy. I have heard very recently that I finally sound pregnant because my nose is swollen shut. So if I sound like I'm gasping for air, I promise I'm not dying. It is because I am hella pregnant. But yeah, that's my personal update. Unfortunately, I'm lucky that I have a lot of support and that my work is very distracting right now. Things are crazy. Lots of changes are happening. And of course, with Surge and all the flu and the COVID that's still going on, it's been wonderfully distracting.
Haley, we are so sorry to hear. We're so sorry. We're all here. I know that we kind of become a family. You're new to this family, but please feel free to reach out to any of us. I still feel close to babyhood stuff because, I've got the 2-year-old. I understand that that's a really heavy load for you and your family, but we'll be here for you, I promise, okay?
Eric, how about you? I hope it's more positive than mine.
On my end, nothing too much has changed. Just been focusing on work and school. I am in school, even though no one really knows it at my work, just kind of keeping it quiet. And I've just really been focusing on that personal wise, work wise. I mean, it's kind of personal and work are the same thing for me. It's like work wife, work life, work everything. It's all the same thing for me. Maricela, how about you?
Professional updates, not a lot. I know I mentioned that our whole system is switching to an upgraded Epic version. And I'm super excited about that because it's going to be tap your badge to sign in. And I had that at my previous hospital. And when I say it's life-changing, I'm not even joking. I swear it probably shaves off an hour of typing in at every computer, every station. And then we're going to have the rovers, I think that's what they call them, basically Epic in your hand. I have a lot of time blindness in my personal life and my work life. So the idea that I can actually chart on the spot without having to worry about a big giant computer, I'm very excited about that. In my personal life, I have been a terrible snoring person at night. I terrorize my family. It doesn't matter if it was before children, after one child, after 4 kids. It's definitely gotten worse, but I have always done it. My mother is the same. My grandmother is the same. So I've always been a bad snorer, and I've had a referral for a sleep study about to expire. And Mary Tess, in our last episode, inspired me to take my sleep seriously. I have the little ones 2, 4, and 6. So the past 6 years, basically, I've been neglecting my sleep, whether if I'm blaming a newborn or I'm blaming night shift. And those excuses are both gone because now I'm day shift and my youngest is 2. It's time to take care of this. So I did a sleep study, and it was kind of interesting to do because, we've usually recommended our patients, like, I noticed you're desatting to the 80s in your sleep. Has anyone ever told you need a sleep study? Turns out I did, and I have mild obstructive apnea. So the next step is that they're going to tell me what my options are. Kind of interesting because I know the only option I'm familiar with inpatient is CPAP, but it sounds like they now have molds for your jaw, things like that. So excited to dive into that, take my sleep seriously, and hopefully more energy. Here I am thinking I'm tired because I have 4 kids, but maybe I haven't been sleeping right for a long time. Well, why don't we move on to our topic? The ups and downs of float nursing. Who would like to get us started?
I'll start. I'm the oldest one here, but I remember the first time I ever floated to a unit and the sense of dread that I had. I remember crying all the way to the other unit and getting there feeling completely lost.
For me, Definitely. I remember my first time floating, y'all. I had a huge sense of anxiety. I was already 8 months comfortable on my unit. I did not want to float. I did not care about floating, but the minute I floated, I got to the unit scared, nervous. But I remember one nurse gave me some great piece of advice. She said, have a little sheet of paper and stick to a little cheat sheet. And so she said, every time you float, make sure you know where the bathrooms are. Make sure you know where the supply closet is. Make sure you know where the Pyxis room, where you get your medicines. And she said, every floor you go on, have a little float cheat sheet. So from that point on, I just kept those tips with me. I always had a float cheat sheet, and I normalized the thought of me having to ask for help. That was another thing, because different units would have different specialties. So nursing is nursing anywhere you go. The more I floated, the more I became comfortable with going to a different unit. It's just taking care of your patients, knowing where your rooms are, and knowing who to go to for help. I'm like, who's the resources? Who's the charge nurses? Who's the PCTs that I'll be working with? And just understanding that nursing is the same no matter where you go, and just changing the mindset towards being a float nurse or floating for that day.
Yeah, I feel like that's always, at least when I was floating, was always the most anxiety producing, was going to a floor that was such a different specialty than I worked on. When I was inpatient at a larger hospital, I was on a cardiac telemetry unit. And when I got floated to that ortho floor, I was like, oh my God, there's wedges and donuts and crutches and all these things that when I had a hip replacement patient, I felt like I was back in nursing school, like looking up, all right, they can sit at, is it 90 degrees or 30 degrees? And like you said, having that resource of someone to go to, whether it's the charge nurse or a friend that works on that unit, to be able to ask questions. Nursing is nursing, but you also aren't going to know everything. So when you're floating, you're there to help, but they can't expect you to know everything about their floor. So don't be afraid to ask questions, because the worst thing you can do is not ask a question and then something go wrong when you're the guest on the floor.
The last time I floated, it was to the neuro unit. I'm used to neuro assessments, but I did my first ever spinal assessment and I was going through it and I'm like, ugh, like you're checking rectal tone? Really? Like, how am I supposed to do that? And it feels like forever ago now, but it's really about learning where your resources are. And there's kind of a stereotype of it. If when you're getting pulled, you're getting the worst assignment. When you're not necessarily getting the worst assignment, it just might feel more stressful for you in that moment because it's an unfamiliar environment and sometimes an unfamiliar population.
No, when you're getting pulled, you're getting the worst assignment. It's just like the travelers always get the worst assignments. Everyone knows it, no sugarcoating it. And I have checked rectal tone for so long, and then I became a nurse. But it's so funny listening to everyone speak, because I sound like I'm a listener of the show, because at our facility or here, you don't float outside your hub. So you don't float to anywhere else. Med-Surg floats to Med-Surg. Only ortho nurses get ortho patients. You know what I mean? It's so strict and specific here. So it's like, it's funny when you speak about all those things. I was like, wow, that's exciting. That's not anything we ever have to do. My previous hospital, we had a dedicated float pool where the nurses were actually hired into the float pool position, and they pretty much had like the highest training, and then they would go throughout the hospital. Here, if we're short on a unit and overstaffed somewhere else, they will send someone. It's pretty straightforward. No mixing.
Yeah, that's what I am, Eric. I'm part of that float pool. I'm in the hub, and we just get shot out wherever we're needed. And exactly what you guys are saying, that everyone asks me, they're like, how can you stand not knowing where you're going to be that night? How can you stand not knowing what everybody's talking about? I will say it's very humbling every time you show up to a unit, because you kind of just have to accept that you look dumb, even though you know you're not. You know that you're 8 years a nurse and this is a brand new nurse, but on their unit, they're using certain abbreviations that they use every day. And on another unit, we're not going to know those ortho abbreviations, those neuro abbreviations. If you're usually a pulmonary floor, you're used to those abbreviations. So little things like that, people will look at you like, you're weird, you're dumb, you don't know what you're doing. And you just got to let them think that, because as you work your shift, you're going to show them exactly that you're not, and you're very resourceful. And if you need help, you ask for it. And that's the smartest thing you can do. Part of what I also love about being float pool is I do feel like a mysterious hero because I swoop in. I don't ask for a lot of help. I used to work with quadriplegic patients, and I got used to not having a tech around when I really need to do a big cleanup or whatever. So I'll be doing a big cleanup all by myself, and the CNA walks in and they're like, "Do you need my help? How do you know how to do this? Or how do you know how to?" I'm like, "Oh, I have experience." But it's usually, like you said, long-term patients that are heavy acuity that they give to the floats because their staff is exhausted. They might be emotionally exhausted, physically exhausted from this patient. I have more than enough patience for these patients. First of all, I'm part-time. Second, I'm not back tomorrow with these same patients. So my secret is that I don't have to deal with them again. So I have no hard feelings. Every time that I come back, I've got a new load. I'm welcoming the hard load for sure.
I was just going to say, I feel like when you're the charge nurse and you know you're getting a float, like you don't want to give them a hard assignment on purpose. But like you said, it is kind of nice to give your staff a break from a patient that's been there for a while and might be not necessarily getting along with the staff or is high acuity. It is nice to know that there's someone coming in that can have either a fresh perspective or, like you said, is able to take on that mental load because it's just for a day. I'm sure some other floats have the same mindset as you, feeling like they're the unsung hero, but it's nice to know that some people feel that way.
I know there's a bad rap for floats that take it as no one's going to track what I missed and what I didn't do. I've met a lot of those float nurses too.
The worst thing about you float pool nurses, Maricela, is when you come on, you're like, oh, why do I have to do this? Or how did I end up here? Oh, what's going on here? It's like, honey, you knew what you were signed up for. I'm always amazed when they're shocked that they're floated to another unit. You're like, what? I'm going to go there tonight? It's literally the float pool is what you're signed up for.
For sure. And I feel like I saw a lot of that at my previous institution, and it's the culture. So sometimes you realize this hospital does not have the culture I'm looking for. So I actually see a way less of that at my hospital that I'm at now. And I don't like that either. It's like you're surprised that you're getting patients and they have medications to get.
One of the biggest things that kept me where I am is that I'm making friends on my floor and I'm like building relationships. Really, they're lifelong friends that I've hung out with. The ones that I've started with are probably my best friends. How do you navigate that knowing that you're seeing new faces every time you come into work?
I've got that under pros and I've got that under cons. So think of it this way. Sometimes you make those close connections, and as a long-term float pool, like I've hit a year, I visit these units again and again, and I leave a lasting impression to where I feel like I'm making some relationships now a year later. But you're right. You don't have those same close everyday relationships. But let me just show you the other side of the coin. Sometimes you're over those relationships and they're not the best friends that they could have been. And there's drama and there's gossip. And I get to avoid all those things. If I want to join a conversation, people let me. And if I don't, no one's like, why isn't she joining the conversation? No, well, she's float pool. Of course she doesn't care. If you want to make those relationships, you're able to, but not the same way for sure.
It's a pro to be able to step away from the toxic and not feel like you have to participate in it.
Yeah. And the good thing I've noticed about float pool nurses is they're some of the best nurses I've ever come in contact with, honestly, because I think you guys are willing to go to the different places and you build up such strengths from the knowledge that you obtain from going to the different units. And I've really enjoyed over the years seeing that and coming in contact with you. So kudos to you guys. If you keep it up and really enjoy it, I think that you'll really be a good, strong nurse from it. And I've actually hired nurses out of the float pool in leadership roles because of that. So most recently, I have a clinical supervisor and another nurse that I'm hiring out of the float pool.
Be careful, Maricela. Keep away from that leadership role. They're coming for us.
And we'll tell you, Eric, that's part of why I like float pool. I like the spontaneity, the flexibility. I will not be taking any manager positions anytime soon.
Okay, now we're going to be with you for a while.
True. Let's see how I look at the end of this next 2 years with you guys.
I know, Eric, I've been taken to the dark side I'm doing my master's. What happened?
I just had to delete your contact. Oh,
Yes, Marcella, I'm very interested in watching you and seeing how you navigate through the float pool nursing. I'm like everyone else, but I know for me, my old hospital system, what we used to do was we was always short staffed. I used to work in North Carolina, and this particular floor, we would have agency nurses a lot. And so my manager and charge nurse was just really wanting the float pool nurses and excited about the float pool nurses. So I'm sure if you were one of our float pool nurses, we definitely had like a welcome sheet for you all. We said, welcome to our unit, float nurses. And we would have like the codes. We would have the contact information. We would have where different things were. We actually would have like little cupcakes for you. In the morning huddles, we would introduce you. So we made it a really big deal with our float nurses because we loved you and we wanted to just embrace you. We knew you probably did make a little more money than us. We probably knew that you knew a little more than us and you may have had those heavier patients that day, but we just embraced it and we were just really thankful for y'all on the floor. So that was pretty neat. So
I love that recognition. And it is things like that when a unit does that, a cheat sheet with everything on it, a hello, hands me my Vocera or my phone for the unit already logged in. I'm like, you guys are awesome. I'm used to not getting that. So I'm totally happy when I do get that. And that's super crucial to safety on the unit. If there's a code going on, I need to already have all this stuff set up. I need to already be logged into the Pyxis. I need to know the codes to get the rapid response situation going. Those sheets are crucial. And because sometimes we're kind of taking on a different kind of risk, I don't want to say bigger, but because we are every time going on a unit and if there's an emergency situation, we've got to be on our toes and sheets like that help us. But yes, I feel like we do deserve just a couple dollars more, sometimes. And I was not getting that at my previous institution. So I was not liking the culture. I was not liking the pay. For one, I'm less than full time, so I get no benefits. And if they weren't offering any extra pay for me opting out of benefits, I wasn't happy with that. So at this hospital, my pay is a little bit higher and they understand that I'm taking on those risks. So thank you for being so accommodating to your float nurses. I will say every time I get a thank you from the unit, I feel a little guilty because these are my required hours. I'm not volunteering my time, but hey, I never say no to thank yous.
Marcella, do you ever feel any pushback from any of the nurses coming when you come on the unit? Like you're an outsider?
Yes, people look at me like I'm an alien sometimes. And like I said, during report is when people do a quick assessment of, do I know what I'm doing? Do I not know what I'm doing? And usually, like I said, I just got to be humble. I know you're looking at me because I don't know all your abbreviations. They look at me like, can I be giving you these patients? And then if they're back or by the next shift or by the end of report, they feel a little more comfortable the way I talk about it, the way I ask questions. So I kind of just have to prove myself to those nurses. But when it comes to patient safety, if there's nurses like that, they really got to set that aside. And I set my pride aside too, because it's really when you set me up for success as someone who doesn't know what's going on, those sheets like Kellye mentioned, with the codes, who's in charge, the clearer the sheets are, the faster I can get my shift started. We mentioned this once before, isolation rooms. If everything I need is already at that door, I can follow your unit's policy in regards to where things are kept so I can do that continuity of care, no issues. I have had units that don't have any assignment sheet, and that's not great. If I need to call a rapid, if I need my PCT ASAP. So no assignment sheet, that's the worst case scenario there. And I have seen units do that.
In my experience, other things you can do is make sure not only do you provide that cheat sheet or flash orientations checklist, but walk the float nurse around and make sure that they understand, hey, this is where the nourishment room is. This is where the clean linens are. This is where the dirty linens are. This is where our 2 negative pressure rooms are. And this is where the assignment board is. These are the key things that are on our unit. This is where the crash cart is, all those things, so that they know where the key areas are on the unit. I think that's really imperative. And hey, do we have key times for staff lunches? I know on my medical obs unit, they tend to go to lunches later because I don't know, they just like more like 1:30 to 3. I think every unit probably has its nuances as well like that. So I think just learning that, and we try to provide lunch relief to each other. Like the charge nurse on that unit tries to help with that. So I think it's important. Hey, we'll try to get you some lunch relief because this unit's very fast paced. Incorporating that float nurse, you're one of us today. It's like Kellye said, even if you don't provide a real cupcake, it's that cupcake feeling when you walk on the unit.
Those are great suggestions. Something that my organization does, which it doesn't necessarily help in real time if you're in emergency situations, but we have a survey system. So after you're pulled or after a float comes to your unit, you can scan a QR code and give some feedback on the unit on what went well, what didn't go as well. So it's something that they can take action on. Unit practice council can implement something to help prevent somebody from having a negative experience moving forward.
Oh, I love that.
If I wasn't a nurse, I would really be believing everything I've heard.
Wait, which part don't you believe, Eric?
No. I'm all for the helping them out and showing them around and like, these are the codes, but they don't. I mean, I've seen it. They come there like, hi, I don't have time. I got to go my patient. Bye. Here's your assignment. Go.
I am usually float RN1. I don't get an A. Or my name is super misspelled, but that's okay. I'm very forgiving. I think that's the other thing. You got to have a little bit of thick skin if you're jumping into this. But those were great suggestions, guys. I'm actually going to take these to all the units. Like, hey, can you have a place where I can tell you what I didn't like about code?
Great opportunities, right, for improvement and ideas.
Well, believe it or not, we're just about out of time. But before we close, let's go around and have each of you share your biggest takeaway from this conversation. Trish, what are your takeaways?
Mine are listening to you as being a float pool nurse, tell your stories. I always enjoy hearing Eric's take on things. I think he levels us out some. And I love the idea of the follow-up survey. I'm going to take that back to our hospital and implement it. I think that's a great idea. Kellye, what is your takeaway?
My biggest takeaway is to really, really take this as a growth opportunity rather than saying it's a punishment. Utilize this experience, grow from it, learn who you can learn, network, and different things like that. So that's my biggest takeaway. Sydney.
I think my biggest takeaway listening to Marcella's experience about how different all of the units she goes to can be, I think it's an organizational thing. I feel like within hospitals, or no matter what the specialty is, I feel like our department shouldn't be that different to where it can be such a struggle, especially if you have a float pool. They should be larger systems, things in place to make it more seamless throughout the organization. So I guess I didn't really learn anything about that, but it's food for thought. Haley, what about you?
I think my biggest takeaway is that I need to give my float pool friends some more love because they're maybe not feeling as much support as I thought they were feeling, because I'm hearing now how frustrating it can be. And I hear previously from my organization that sometimes people feel like they're getting the worst assignments. And it sounds like it's something that's beyond my organization. It sounds like it's much bigger than that, unfortunately. So I got to give some love and give some metaphorical or real cupcakes. Eric, how about you?
My biggest takeaway is that unless you're actually hired into the float pool, being floated is a punishment, and you're being punished for the hospital's inability to staff appropriately. And you can still use it as an opportunity for growth. You can use it to expand your nursing skills. On our end, like I said previously, we don't really float outside of our hub, but I think it would be a tremendous opportunity as long as you can do it safely. It's a wonderful opportunity. I take it as a little time to spread some more gossip and to help see what's going on and just get an overall feel of the hospital. So it's great.
I think that float pool ended up being such a saving position for me. Let me explain. I've been on units with long-term patients. We're on a pulmonary step down. People who are waiting for lung transplants have gotten lung transplants, and then they got to live with the complications from that. But I will say that it is something special that I think nurses should experience, those long-term relationships with patients. But if you're at the point where you're sick of your unit, if you get excited when you find out you're floating, that's what started happening to me, then I do recommend before you jump into a float pool position that you actually just pick up shifts on various units and see how that feels. If you're just like, it's too painful, to just every time be on a different spot, then you don't pick up shifts anymore. You tried it out. You go back to your unit or you find another long-term unit. But if the excitement of not knowing what you're going to get or just mixing it up, trying different specialties and not necessarily wanting to move into a manager position, but trying to move laterally, just sideways, check things out, I would totally recommend to people to try a float pool position. It would be better to do it in a facility that you already work at, so you're not 100% clueless like I was when I first started in this position, new hospital and float pool. But I do recommend it to people to try picking up shifts on random spots just to feel it out one day and kind of practice too. If you haven't floated and you want to practice floating, go ahead and pick up a position if your facility allows it. Well, to our listeners, thanks for joining us. We'll see you next time on Med-Surg Moments, the AMSN podcast.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurg Moments on your social post.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Sydney,
Eric,
Trish,
Kellye,
Haley,
and Marcella. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.